Hi, I'm Jessica, a member of NAFA, the Size Diversity Task Force, and ASDA. I am also a mental health professional, a dancer, I practice Pilates, and health at every size. My most recent experiences have not been with doctors. The first involves exam and waiting room accommodations. Kaiser is raising its consciousness around waiting room accommodations, but the exam rooms leave a little to be desired, especially for OBG appointments. My experience at my last OBG appointment when I had to have an exam was that I was taken to what seemed to be a locker room. Yes, the gym type lockers. This is where they chose to place two size appropriate tables. This type of substandard treatment makes me feel less than, and that the quality of my medical care does not mean as much to my healthcare practitioners as those that fit into their normal furniture. The second involves the way that physician's assistants interact with me. With the questions of family history and weight. I do not and have not weighed for several years. The reasons are twofold. First, I'm triggered when using the scale. Immediately, when I see the numbers, no matter how good I feel about myself when I go to see the doctor, my attitude is immediately affected when I see the numbers on the scale. Secondly, because I am not on any medications, my treatment does not have anything to do with my weight. So when asked to weigh, my answer to the question is no, I don't weigh. But it's not that I have to answer. It's the painstaking look on the assistant's face when she asks. That grimacing look like I just passed gas or something. I don't have any problem with being asked how much I weigh, but to answer to a person who feels that being fat is shameful or something to be ashamed of, that's where my problem lies. I say leave your personal biases at home. When you're treating individuals, we need your care, not your pity. What I would like to see is exam tables in every exam room that accommodates a variety of body sizes and shapes. I would also like for medical professionals to receive ongoing sensitivity classes to reduce and eventually diminish fat stigma. I would also like to see ongoing training that enhances practitioner and assistant knowledge in size acceptance and health at every size. This last visit, I did not feel strong enough to advocate for myself, so I just wrote it off. But if I have another chance, I resolve to educate the assistants when I experience a look or whisper in reference to my weight or being weighed. I also resolve that if or when I have appointments that are particularly stressful, that I will find someone to support and advocate for me, someone who's on my side.